Why is a public health agency refusing to release data that could answer the biggest question since 2020? And why were pharmaceutical companies allowed to see it, but you weren't? Let's unpack what's actually happening, because this story should be everywhere. According to official reports, the UK Health Security Agency has refused to publish anonymised data showing the dates of people's COVID vaccinations matched against the dates of their deaths. That data set already exists. It has already been shared with pharmaceutical companies, but it has not been shared with the public. And the reasons they've given are astonishing. One argument was that releasing the data could distress bereaved families if a correlation was discovered. Another said it could damage mental health. And then there's the big one. It could lead to misinformation and negativity impact vaccine uptake. There are concerns here because that logic isn't public health. That's narrative management. A cross-party group of MPs and peers raised the alarm last year, pointing out that public trust is already shaky and that the fastest way to rebuild it is transparency. They noted there is no credible reasons why anonymised data, the same data given to vaccine manufacturers, shouldn't be available to you, me, and independent researchers. And a campaign group, Us For Them, spent 2 years fighting this through the Freedom of Information process. UKHSA argued people could somehow be identified, even though they were asked for anonymised data. After a tribunal, the Information Commissioner sided with UKHSA. And that raises a real question. If the government truly believed the vaccines performed as expected, why avoid scrutiny of the dataset that can prove it? Even Us For Them's legal director said the handling of this case reveals a desperation that this data could not see the light of day. He compared it to the infected blood scandal, where the state decided the public couldn't handle the truth, so they hid it for decades. Now, nobody's claiming causation. Nobody is claiming a cover-up of harm. What people are asking for is transparency, because excess deaths have been higher than expected in multiple years post-2020, and ignoring it hasn't solved anything. Reform UK is promising a public inquiry into excess deaths and alleged vaccine harms. Whether people agree with them or not, they've absolutely touched a nerve, because this refusal makes the government look like it's scared of its own data. So here's the real issue for me. If the state starts deciding what information you can see based on how they think you'll feel, that's not public health, that's paternalism. And we're well past the point where people will settle for don't ask questions, we know best. If the data proves everything's fine, publish it. If it shows patterns we need to investigate, publish it. Either way, sunlight is the only way trust comes back.